welcome to my YouTube channel. Today we are going to talk about nutritional assessment. So, all patients admitted to hospital should be screened for malnutrition and have their nutrition state assessed. So we can roughly divide this nutrition assessment into three, where you have the clinical aspect, where you have the body weight and the anthropometric, and where you have the lab techniques. So in the clinical, you have a focused history taking and a physical examination. In the body weight and anthropometry, you have a BMI, usually less than 18.5, usually indicate impaired nutritional impairment, that and below 15 it usually corresponds to high hospital mortality. You can also add anthropometric measures, that is skin fold thickness, the mark, that is mid-arm circumference. In the lab techniques, you have albumin. Albumin less than 30 grams usually indicate more of malnutrition, but it is not a specific tool. Others like lymphocyte count and skin testing, which show defective immune system, but still not a specific tool for malnutrition. But these things can help you determine if the patient is malnourished or not. So later we are going to look at a tool that is called the MASS tool, that is done to every patient to assess their nutritional assessment. So this is the material that I was talking about, which is a malnutrition universal screening test, which is just a 5-step screening tool to identify adults who are malnourished or risk of undernutrition. So this is, we said, it's a 5-step screening. The first step is for you to determine the BMI. So you score the patient 0, 1, 2, 0 if the BMI is greater than 20, 1 if the BMI is 18.5 to 20, this should be 20, and 2 if the BMI is less than 18.5. So the next step is for you to determine the weight loss. This weight loss should be an intended weight loss. In 3 to 6 months, it's either you score 1, 2, and 0, 1, 2, 0 if the patient weight loss is less than 5%, and 1, 5 to 10%, and 2 for greater than 10%. The third step is to assess if the patient is in acute illness or disease, or if the patient has had little nutrition intake for greater than 5 days. Later, you add these scores and you determine the overall risk of undernutrition. So if your patient scores 0, this means that they are at a low risk of undernutrition. If medium, if they score 1, they are at medium risk of undernutrition. If they score greater than 2, they are at a high risk of undernutrition. So depending on the score that they get and the indicative of the score, you will now get what you're going to do to this patient. So for example, if it's 0, you just have to repeat this the screening test later. That is, if the patient is at the hospital every week, if they're at care homes every month, and if they're at community, you do every year. So if they are 1, that is medium risk of undernutrition. If they're at hospital, you document dietary and fluid intake for 3 days. If they're at care home, you do the same as hospital, and they're at community, repeat the screening test. If they are more than 2, that indicate that they are at a high risk of undernutrition. If they are at the hospital, you refer to a dietitian and implement local policies. And then you do the same for care homes and community. So the next thing is just like a summary of what we talked in the first slide, where we categorize nutrition assessment into 3. We say there's clinical aspect, then we say there's body weight and anthropometric, and then later we say there is lab. So this is kind of a summary of everything together. So in the dietary, what are you going to ask this patient? Are they anorexic? Are they nausea? Are they vomiting, diarrhea, malaise? Also the history of weight loss. It is significant to know that this weight loss must be an intentional weight loss. So if they have 10% of their weight loss in 6 months and 5% of their weight loss in 1 month, it's an indicative of significant weight loss. In the physical examination, what are you going to look? You're going to look if this patient emaciated. How do they look? Are they apathetic? So you also assess the body fats, you also assess protein store, you also assess metabolic stress. So in metabolic stress, there are several things. Here is where now you assess the lab, as we said in the previous slide, where you can measure albumin, you can measure WBC count. However, note that this These measures are not specific for nutrition, but they are just things that will help you assess the nutrition state of the patient. The last thing that we are going to talk about is the physiological function. So if this patient has been having wounds, do these wounds repair? If you have done wound healing, you really know that nutrition is very essential for the healing of wounds. Do they heal wounds well? Is it fatigability, grip, respiratory function, muscle test? So this is just a rough idea on how you can do nutritional tests. Thank you for watching.